So when we look at the face with the aging process, we must look at the cheek volume as it deflates as we age. Hi, I'm Noreen Bollinger, nurse injector at AesthetiCare, a world's leading clinic. So what is cheek filler? Filler is hyaluronic acid that we make in our body, and so it is almost identical to what we make. The only difference is that it's bound together with cross-linking. So when we are putting filler in the face, it's essentially replacing what we've lost. So as we age, we start to get fat pad deflation. So our superficial and our deep fat pads start to go away or get smaller. In addition to it, the cheekbones or the zygomatic bones start to get bony reabsorption. That means they're less dense. So the structure, which is the bone, gets smaller and the fat pads get smaller. They also descend down and in, which leads to all this lower face heaviness. So cheek filler, what can it do? It can give us volume, restore that youthful volume that we once had. So by placing filler on the bone or in the superficial fat pad, we can make this beautiful cheek that looked like we looked about 10 years ago. It should be very smooth, very soft, very natural. You should not look like you've had filler. If you look like you've had filler, you did not go to the right person. It's never the filler that's bad, it's the person putting the filler in. So if you see someone that looks crazy, no, that's not the filler. Know that the person putting it in put, number one, too much filler, number two, in the wrong plane, or number three, the wrong kind of filler. So it should be exactly like your natural fat pads. We're replacing fat pad loss and bony loss. So it should be so natural. We should never be afraid of cheek filler as long as you're going to the right person to put the product in your face. So where do we inject cheek filler? Well, that depends on the patient. Each patient is individual. Some patients come in and they have really, really strong cheekbones, but they're really deflated underneath and in the temple. So if I place cheek filler right on the bony prominence, it's gonna make it look more prominent and make them look more hollow here. So it depends on how you present. If you've got really high cheekbones, but you're flat and don't have much facial fat, I'm gonna inject this medial portion of the face, and then I'll blend your cheekbone out to make it a smooth transition so we don't have any deep shadows. But if you come in and you have a lot of heaviness in the jowl and around the mouth, I'm gonna place it on the high cheekbone to try to give you a stronger lateral lift so you have less heaviness here in the mid face. What to expect from start to finish with cheek filler. The first thing I'll do is do a full face consultation. Our facial features balance each other. So we're not just looking at only cheeks. We're gonna look at how your cheeks and your lower face transition to each other. So I'll do a full facial assessment and I'll give you the key items we're gonna start with. And so many times, if you've got some lines around the mouth, heaviness in the jowl, we're gonna start with cheeks. And so a lot of times I'll have you come in, we'll start with that cheek filler, and then you may come back and we'll do your lower face. Sometimes we'll do it all together. It just kind of depends on how you present. So on the day of your procedure, when you come in, I'm gonna have you come in with a clean face, and then I will apply numbing cream to your face. You're gonna sit for about 10 minutes and we'll talk through everything we're gonna do. We will get pictures. So pictures are key. When you come in for any type of filler, I will always do your initial pictures. At the end of your procedure, I'll do your after pictures. With filler, it's instant. So I can show you exactly what your change is from the beginning of your appointment to the end of your appointment. And for me, that is the most impactful part of our experience with filler. I love showing you the difference that I've made because it's soft, it's natural, you don't look like a different person, but seeing those subtle changes can be so amazing, and I've seen people cry time and time again because they feel so good about the results. So we'll take your pictures, I'll wipe your numbing off, I'll get your face clean with chlorhexidine or with something to make sure there's no microbes on your skin so we don't have any risk for infection. And then we'll get started. So it really kind of depends on how you present. Sometimes I'll use a cannula, which is like a needleless needle, and sometimes I'll use a needle. You will feel a little bit of pressure and a pinch, but it's really not too painful. After you've had it done once, it's not a big deal. Some of the comfort things that I use are ice and distraction with my mouth and with a distractor tool that vibrates. And the procedure, once we get started, usually takes about 10-15 minutes from start to finish. You can have bruising, you can have swelling. It happens. Some people will bruise, some people bruise very easy, some people don't bruise at all. So you always want to make sure you've cleared your calendar, that you don't have any big events that you're going to have a beautiful face with no bruising for about a week to 2 weeks after your treatment. After the session, I will take your pictures, show you your before and after, and you'll be able to see the beautiful difference just that one session has made. When you leave, you're not going to wear any makeup. You're not going to rub. You're not going to massage. You're just going to leave the area alone. You're not going to put a dirty cell phone on your face. Who knows how much bacteria is on our cell phone. And you're just going to kind of leave the area alone. It's normal to feel a little tender for a few days, completely normal. If you have bruising or swelling, you want to stay out of the heat because that will increase the bruising and swelling. Within 2 weeks, everything will have completely settled. If there's any bruising or swelling, it'll be gone and you will see your perfect results. Filler loves water. And so even in 2 weeks, you're going to see even a more beautiful result than the right after, because you have any swelling and bruising is gone, and then you're going to see that nice beautiful integration of the filler with your tissue. And so filler lasts about a year, and so it's different for everyone. So just because filler lasts about a year doesn't mean you need it in a year. It means, hey, let's take a peek and see. So when you come back in, we'll look at your pictures and say, hey, how much filler is still there and how much is gone? At that time, if we deem that you need more filler, we'll place it. If you don't and your filler still looks great, then we'll leave it alone. Less is more. You do not want to look like you've had filler. It should be beautifully natural. Just because it's been a year doesn't mean your filler is completely gone, although your friends may be. So everybody metabolizes it differently and the effects are different patient to patient. Overall, cheek filler is such a beautiful way to replace lost volume of the mid-face. To learn more about cheek filler, visit worldsleadingclinics.com.